In young ones, we'll see skin rashes like eczema, psoriasis, and very commonly recurrent ear infections or sinus infections.
You're listening to the Ethos Athletes podcast, where we believe that your health is the number one resource you need to accomplish your dreams. My name is Dr. Matthew Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, this is Dr. Matthew Hernandez, and you're listening to the Ethos Athletes podcast, where we are continuing our series on gut health with Dr. Michelle Retz, who is a physician here at Ethos Integrative Medicine, where she specializes in gut health. Dr. Retz is also the head of Gastroenterology at the Southwest College of Naturopathic Medicine. So Dr. Retz, welcome back to the show.
Thanks so much for having me.
In this series thus far, we've given a gut health overview in episode 1. We then went into talking about digestion, absorption, and motility, which are kind of the fundamental aspects of a healthy gut. Now we're going to be diving into a few special topics with regards to gut health. So this very first one we're going to be looking at is food sensitivities and leaky gut. Leaky gut is something that a lot of individuals have probably heard of. They don't necessarily know what it means. And so we're going to kind of shed some light on what that is, how it can impact people, and some of the causes of it. Dr. Retz, can you kind of talk to us about, before we even get to leaky gut, there's this whole aspect of food sensitivities that kind of cause this, right? Can you tell us what a food sensitivity is and how it differs from a food allergy?
This also is a popular term people may or may not be familiar with. And some, when they think food sensitivities, liken it to a food allergy, which is a very different response. And even traditional gastros and allergy physicians really only think of food allergies. They don't sort of acknowledge the difference between that and a food sensitivity. Which is a more slow burning reaction of the immune system to some aspects of foods. And we've heard, get gluten and dairy and soy and corn and all these things out of your diet for one reason or another. I think people are questioning, well, should I? If so, why? Is it just because it's not good for me? Do I have a sensitivity to it? How would I know? What does that even look like? What's the difference between that and an allergy? And how can I get tested if I do decide that I want to, follow up on that?
Yeah.
So an allergy is an immediate immune response, typical to an allergy that you might think of with anything else. It could involve hives, a rash, swollen lips, itchy tongue, itchy mouth, throat closing, trouble breathing. You could feel just hot and sort of irritated within about 12 hours of having the food. It's pretty immediate. So 1 to 12 hours after you eat something, you're having a reaction to it. When you have an allergic reaction, it's an antibody called IgE. There's 5 different types of antibodies, but the E is the one that's the allergy response. And it's irreversible. Once you have an allergy to a food or anything else, you cannot go back. You can't retrain those antibodies to like that guy, basically. They're very judgy and they're not going to go back and change their minds. It's often triggered even by just a little bit of food. It doesn't take a ton of food to incite a food reaction, and it will never go away. However, it can be a decreased reaction the less you tend to have that food. So it is good, obviously not to have your allergies and poke the bear, because if you continue to eat it even in small amounts, it can worsen over time. So when we do testing, there's several ways that you can do that. Most of you probably are familiar with the allergist test, the skin test. If you've had tests for foods, that's an allergy test. That's not a food sensitivity test. And the way we test for food sensitivities is by a blood test. So you haven't been tested for food sensitivities if you had that skin test. We can also do a blood test, and that's how I prefer to do it. It's awful to do the skin test and have 200 reactions on your back. That's just no fun for anybody. So you can also test for food allergies by blood, and I do that all the time. And we grade them from very, very minor, just starting to have a sensitivity or an allergy, to severe. You can see over time, if you continue to eat the ones that are very, very minor, they will develop into something that's severe, and you would need to have an EpiPen on board and Benadryl just in case, because it could develop into something more serious if you continue to eat it. So you do want to be careful in that regard. A food intolerance or a food sensitivity involves an entirely different wing of the immune system. These antibodies, IgG, they're a little more delayed. 12 to 72 hours after you eat a food. So up to 3 days after you eat a food, you can have slower burning discomfort symptoms, not allergic response. It could look like bloating, belching, gas, indigestion, changes in your bowel movements, an upset stomach. You can have other symptoms I'll cover in a little bit, but it's definitely a slower burn. It's not as intense. So if we can find the offending factor, remove it, heal the lining, and kind of calm down the immune system, you can increase your body's tolerance to that food. So that's the goal when we're looking and treating those kind of things. It's not irreversible at that point. However, a food sensitivity can actually turn into an allergy. And I've seen that happen many times. So just because you have one, you can actually turn it into the other. We don't always have the answer for what's the inciting factor that caused it to turn into an allergy. Why did the immune system decide you want to now have an allergic response instead of just a subtle response? We don't always know the answer to that question. When it starts moving into that territory, then we kind of need to recommend, again, you're moving into allergy territory, not to have that food because it could get worse and worse and worse over time.
Yeah, that makes sense.
And so food sensitivities can have a broader reaching effect on the body outside of the gut. They can lend themselves to autoimmune disease, allergies, and other senses. And allergies are not linked to autoimmune disease. So there is a much broader stroke with the food sensitivities and its effect on the body.
Yeah, absolutely. We've both seen this in practice, and we'll kind of jump into what some of those symptoms are that people experience when they do have really bad food sensitivities. When we're looking at some of the causes of this, what can cause people to have a food sensitivity?
There are many, many causes. Things that affect, firstly, your ability to digest your food really set up your bacteria to have a negative response and your immune system to sort of have a negative response if you're not digesting well. Most of the things we've chatted about already, not having enough stomach acid, not having enough pancreatic enzymes or bile, the things that we need to just chew our food into very small pieces. The gut is like militaristic in terms of its desire for organization. Everything is regulated. I take it in on Tuesday at 9 and only on Tuesday at 9 when I am ready. I don't want it this size. I want it teensy tiny, and very particular. So when things are a little bit larger than normal, one, we feed bacteria that are in that area, so it throws off our flora. Two, our immune system's a little bit on high alert because they're like, why is this giant piece of food here? It's supposed to be really small and tiny. And so they're already on alert. And if it happens every now and then, it's fine. But the more you're having larger, huge chunks of food that the body now has to struggle to digest, the more the alarm is sounded by the immune system. And so the more they're likely to react to a constituent of that food. Other causes would be decreases or changes in gut motility. So things that affect how you digest also affect gut motility, as we've talked about. So we've seen acid, enzyme, bile, how much serotonin you make. If there's a mental emotional concern in the background, whether it's depression, anxiety, PTSD, some of these, bipolar disorder, those affect our serotonin. They affect our gut motility. Things that move through too quickly aren't absorbed. The immune system can react to them because they're not getting digested well. Things that are staying and stagnating are feeding other flora and give the immune system plenty of time to cuddle up and decide whether they like that food or not. And usually they decide no. If there's damage to the nerve that feeds the muscles in the gut, whether that's diabetes, which is a really common cause, gastroparesis, toxic damage, someone had surgery and the nerves were nicked, which I've had patients where that's happened, that all affects motility. And those patients are definitely prone to food sensitivities and infections. I see that quite a bit. Anything that's going to throw off your flora. So when we've talked about good bacteria, how that gets thrown off with not digesting correctly, certain medications like antibiotics, if you have a yeast overgrowth, right? If you're stressed out, these are all things that can affect your army. And if your army is out of whack, you're not going to have a balanced response if you're not digesting well. So you're more likely to be intolerant to things when they're not digested well.
Yeah. Your
army lives in this protective lining, that mucus lining in your gut. That's where they live. 75 to 80% of your immune system, your SIGA, if you guys have heard of that, that's the type of immune system that lives there. Mm-hmm. When you're stressed and your cortisol levels are high, it completely depletes that lining. And that's depleting our immune system, right?
Yeah.
So when we're already weakened, whoever is left is likely to have a heightened response because they're kind of feeling the weakness. They're like, okay, guys, mount up. There's only 10 of us. We used to have 100. We've got to play the part. And so they're more likely to have a heightened response to foods that are there simply because the immune system has been compromised. If there are actual infections of any kind, which could be yeast, an overgrowth of your own good bacteria or bacteria parasites, other pathogens, viruses even, they all make toxins. And those toxins can come up into the small intestine, poke holes in the lining, allow the food to get in, and then the immune system reacts to the food in the blood going, how are you even here? Why are you here? We didn't let you in. It's like, well, there's a hole right up there. I don't know. I just came in.
Yeah.
So really, and we'll talk about this next time, looking at infections as a strong cause of food sensitivities in all its capacity. You can't rule out medications, of course, as sort of a toxin to the gut. Typically, we're looking at acid blockers, which affect our digestion. So we're not able to kill things that come in, and we're also not digesting our food well.
Right.
Antibiotics that kill all our good gut flora that would help us have a neutral response to food. And then anything that we might use for pain, NSAIDs, Tylenol, ibuprofen, aspirin, these all irritate the gut and affect our flora too, and also make us more likely to get food sensitivities. So those are big ones. If we're looking at babes and little ones, typically we don't want to introduce foods to kids before 6 months or before they've got teeth.
Okay.
They're going to still be breastfeeding. And so if babies are having rashes, reactions, colic while they're breastfeeding before they've had food, that can be an easy way to potentially see that they're reacting to something in mom's milk. And then we would need to be looking at what mom is eating, what's coming through to the baby. But when we talk about food introduction, doing it too early, so before the babies have teeth, their immune system is not ready. Babies don't make IgG until they're 6 months old. They only get it from mom, which is why we recommend at the minimum that babies breastfeed for 6 months, ideally 1 to 2 years. But for that reason, they're much more prone to get food sensitivities, especially if they're not breastfed, because they're not getting that IgG antibody from mom, which sets them up to have a good neutral response when you do start to bring food in. The other issue is people are very concerned about their kids getting food sensitivities.
Yeah.
So when they do start feeding them around 6 months, they're really hesitant to give them dairy, corn, soy, gluten, whatever it might be. So they wait. And then they might introduce it when they're 3 or 4, but they tend to give them larger portions when they're older. So they're giving them sandwiches, huge pieces of mac and cheese for their lunch, or pasta later, the glass of milk and the cheese on the sandwich later. They're too big of servings. Okay. And a body that hasn't been exposed to that isn't prepared to just handle seeing that in large quantities. So they're much more prone to have a reaction then if they haven't seen it before. So ideally, you want to be starting to give really small portions here and there around 6 months, up to 3 or 4 years, just giving them small samples of the foods and see how they do. Early cessation of breastfeeding, obviously, before 6 months is a cause as well, because babies, again, won't get the IgG antibody. Exactly. If a babe has had reactions to vaccines, that's an indication that the immune system's already confusing things or hyperreactive and more prone to confuse something else. So if they're confusing a constituent metal in a vaccine, they're also more likely to confuse a protein, a carbohydrate, or fat in a food. Okay. We do see that definitely with kids with autism and other issues. Gut issues and food sensitivities are huge in those populations. If someone, child or adult, has had frequent antibiotics, it really just throws off their flora. If they haven't had any probiotics to replenish, their army, that again feeds into your ability to tolerate a lot of different foods. So the less good guys you've got, the more intolerant you are to foods. And then toxins, just toxins that we get in as adults, alcohol, pesticides, and other things that come in on our foods. Some of us are more sensitive to that than others. Those also poke holes in the lining and then allow the food to get into the bloodstream and incite a reaction from the immune system. Steroids also, if someone's been on oral prednisone for another concern, not really a topical steroid or an injection in a joint per se, but a whole body steroid situation like for Crohn's or something, that also can really affect their immune response and make them far less tolerant to foods.
Is there any genetic component as well to this?
Totally. So we absolutely see if a child has one parent with a food sensitivity, they're about 30 to 35% chance of having a food sensitivity themselves. If both parents have at least one food they react to, they have a 65 to 70% chance of having a food sensitivity themselves.
Lots of things that can cause it, but ultimately we can sum it up as if you take care of your gut and all the stuff that's flowing properly in the first 4 episodes we talked about, you usually that should have a pretty decreased chance of getting a food sensitivity.
Yeah.
Let's say for the individuals who do have it, or maybe they don't know they have it, we can talk about testing later as well, but what are some of the symptoms that you've seen people experience with food sensitivities in particular?
Yeah, there are a lot of them that are pretty vague, so not too helpful. And sorry, folks, because they can leak into lots of other gut issues as well. But commonly, it'll start in the gut, and then we see lots of things can get linked outside the gut. Bloating, belching, gas, either feeling bloated or looking actually pregnant with air, right? Feeling nauseated and having changes in bowel movements. So that could either be constipation or diarrhea. Those are really the most common things. They'll usually feel worse after eating, not so much on their own. But again, that reaction can be up to 3 days after they eat a food. So it can be really hard to tell whether it was what you ate today or 2 days ago. And that's why I like to do the blood test, because I don't want to take food out of people's lives. Food is life. Food is not, oh, what are we having for dinner? This is like, my boss promoted me and we're getting married and come celebrate my birthday. That's food, right? So we're very careful not to just rip things out of everyone's diet. But when we're looking at, those are the most common gut symptoms that might start for someone.
And then obviously it can go outside of gut symptoms. I've had cases of individuals who had joint pain, and then when I'm doing their intake, I find out they have pain in multiple joints. It's not autoimmune related in the case I'm thinking of in particular, and they have it ends up being a food sensitivity that is the cause of it. What are some of the things that people can experience, symptoms that are outside of the gut overall?
Definitely. In young ones, we'll see skin rashes like eczema, psoriasis, and very commonly recurrent ear infections or sinus infections. Yeah. Those are a sign. The chronically swollen adenoids, when they want to take kids' adenoids out right away, it's usually a chronic immune reaction to food. Very common. In adults, oh my gosh, there's so many symptoms. Fatigue is huge because we're on the larger level, we're looking at how well are you absorbing everything that's coming in, right? The cause of these holes in the lining. So then it's like you're not absorbing food, but you're also not absorbing nutrients. So a whole host of issues can happen, from that.
Absolutely.
Fatigue is huge. You might see like dark circles under the eyes or bags under the eyes. Headaches, they just don't feel well. Joint pain, again, any skin issues are very common. Eczema, psoriasis, even vague rashes that aren't eczema or psoriasis. Weird issues on the scalp or flaking on the scalp, also very common. Itching, you can see bloating, puffiness, water retention, all day or just at different parts of the day. It's not like water retention down in the feet. If you've been standing on your feet all day, then you put your feet up and it goes away. It doesn't go away like that. You could even see it in the face or the hands. They just ache. The joints hurt, muscle aches. They just don't feel well. They actually may even feel like they're fighting something. They could have recurrent illnesses that they're just not really able to mount a response to. So a cold could linger for a long time, or it could always turn into a bronchitis or something more serious because their immune system is busy and weak and not able to mount the appropriate response to other infections. You could see sores, IBS, people with, I hate that it's not a diagnosis. It's, I'm sorry, your stomach's upset. I can't figure it out. So people who have been diagnosed with IBS potentially, but we get under that diagnosis and figure out, is it food? Is it an infection? What is it? You could see asthma, allergies. Definitely asthma is interesting. It wouldn't occur after exercise, like, exercise-induced asthma. It could occur later, 12 to adulthood, and it would happen like after you eat. It incites an asthmatic episode, or they start coughing and they have asthma, later in life. It looks really weird. Asthma is not associated with eating, but the nerve that serves the entire gut, the vagus nerve, also serves the lungs. So when he's irritated by a reaction, he has a reflex spasm in the lungs. So this is how a chronic cough, chronic sinus infection or ear infections that won't go away, or asthma can be really common signs of a food sensitivity. But typically people will be having those gut symptoms as well. Yeah. It won't be such a mystery. It's just that most physicians are taking a tunnel-shaped lens to the lungs or the ears or the sinuses and not recognizing the more holistic picture.
Yeah, absolutely.
The gut may be involved. Yeah.
There's also a correlation with autoimmune disease and food sensitivities, correct?
Definitely.
Can you speak a little bit more to that?
Yes. An autoimmune disease is one in which the immune system is confusing a part of the body for something else. It thinks it's doing a great job in killing an infection, getting rid of something that's harming us. Our job as naturopaths, and I think we do a great job here, is to figure out what it's confusing it with and remove it so we can calm down the response and ultimately calm down the disease. 5 to 7 years ago, really the main idea behind that was, well, okay, the immune system's overreactive. 75 to 80% of the immune system lives in the gut. You got a good chance of finding out what's going on by looking in the gut, which is still true today. So we would typically run food sensitivity tests first. That thought process has changed a little bit, and we'll chat about that in the next podcast, but this still holds very true. So when we're looking at what is confusing the immune system, oftentimes a protein in a food will look very similar to a protein in a joint, the thyroid, the skin, or wherever it might be, the lining of the gut in Crohn's or celiac. And every time it sees that food, it creates a larger part of itself and a wing of the army, so to speak, to say, okay, saw that food. You boys, go get on it. We're going to stay over here and deal with this. So it tries to be really smart, kind of like your stupid second cousin, like he means well, right? But then he thinks he's attacking the food and he goes off to the side and starts hitting the wall, and he's like, you're like, Johnny, love you, but no, he creates clones of himself. Now you have this giant army of confused Johnnies running around, right? So every time you have that food, they run the wrong way. They go over to the joint and they start attacking it. And they think they're doing a good job killing the food, getting the thing out of the body, but they're really just causing more damage. So our job is to figure out, okay, if that's a food sensitivity, what is it? Mm-hmm. It's not everything that shows up on the test.
Yeah.
What is it? How do we remove that, heal the lining, calm the immune system down, and then get the autoimmune disease kind of in remission if we can.
Perfect. I meant to clarify this earlier. So we're talking about food sensitivity being IgG reaction, right? Mm-hmm. Versus an allergy that's an IgE reaction. One of the common questions that I get asked is, well, if I have a food sensitivity to dairy, is that the same thing as being lactose intolerant?
Great question. And I am often correcting this too. No, they're two totally different things.
Right.
So lactose intolerance is you don't make the enzyme that handles the lactose sugar in milk. And that's made on the lining of the intestine. So that usually shows up by about 2 years old if it's present, because you should be making that enzyme by 2 years old. So when you're given cow milk, that's usually how it shows up. It's not there's not lactose in breast milk. So you're not going to react to mom's milk. It would be cow milk. It'll usually cause diarrhea and very much colic in babies. A lot of gas, belching, distension, pain, and diarrhea. There's always diarrhea because the body can't break it down. It just shoots right out. Mm-hmm. So as an adult, you should have the same reaction. You really don't tend to grow into making the enzyme, although some people can, or they may have milder symptoms. But usually that diarrhea piece is always there. Food sensitivity, again, is a reaction to usually the protein in food. It can be the sugar, but this is an immune reaction. Same thing we've been talking about where the immune system decides it thinks that protein is foreign. And in the case of dairy, it's casein or whey proteins. It has nothing to do with the lactose sugar. So if you're watching dairy, you want to be careful on a label to look for casein, CASEIN, that's the name of the protein, or whey protein powder, or sometimes they'll just say whey instead of milk or cheese on the label. So those are things you want to be careful about.
Going back to food sensitivities, they can cause all these symptoms, cause autoimmune disease, different things like that. And they can lead to what's called leaky gut, right? Or intestinal permeability. Can you explain what that is? Again, leaky gut, something that people have heard. They may not know what it is.
Definitely. So leaky gut is the nth degree of food sensitivities. It is the gut lining is so compromised by whatever the underlying cause is. The holes are so big. The inflammation is so severe. So many foods are getting across the border unfettered and into the bloodstream, causing an immune reaction. There's a huge immune reaction. And the symptoms are much more intense. The picture is much worse. It can be really hard for some practitioners to figure out how to treat that and what the causative factors are, but we can talk about that. It's a much bigger cycle. It tends to take 4 to 12 months to heal, usually 4 to 6 months to heal, rather than the usual 2 months it might take for a simple set of food sensitivities. Okay. On a food sensitivity test, the difference in reaction would be a mild to moderate inflamed gut might react to 5 foods. A moderately inflamed gut, and I mean categories of food. So, not just types of cheese, but like dairy as one category, eggs as one category, wheat, soy, whatever it might be. A moderately inflamed gut would react to 5 to 10. Moderately severe is kind of a gray area, 10 to 15 foods. And then anyone who reacts to like 15 to 25 foods or more, that's that leaky gut picture and categories of food, right? So we're counting it up and it appears they're wildly reactive to so many different things. So there's significantly decreased absorption of nutrients as well as food. And the bloating, belching, gas, diarrhea, all the other symptoms are far more intense. The level of inflammation is much more severe. The nutrient deficiencies are much more pronounced, and I'll kind of go over what those might look like. The immune reaction and propensity for autoimmunity and allergies and other issues are also much more pronounced. It's the nth degree of food sensitivities. Very similarly to food sensitivities, the same causes we've talked about, NSAIDs, aspirin, acid blockers, antibiotics, stress, alcohol and toxins, you're more prone as you get older, any infection, anything that compromises digestion, and steroids. It's the same causes behind it. It's probably just gone on a lot longer.
Yeah.
And there hasn't been any appropriate healing. The symptoms can look the same, but they usually are more intense. So bloating, belching, gas, diarrhea, constipation, abdominal pain, nausea, but then they also are far more likely to have those outside the gut symptoms, the joint pain, the fatigue, the rashes. Those are far more common. Brain fog is huge. Cognitive difficulty, asthma, allergies. They're so reactive. Here you might see thyroid issues as well, adrenal issues, because we're looking at nutrient loss.
Right.
And that starts to get very serious.
Yeah.
Exactly. Very quickly. Some really common things you'll see as a result of deficiencies here are like B12 deficiency, which would be numbness or tingling on both hands or feet, from the elbows to the hands or from the knees to the feet. So if that's happening, they're not getting enough B12. If they're not getting enough of their fat-soluble vitamins like vitamin K, they might be bruising more easily. Vitamin A, their vision might be changing at night. Vitamin D, they could have low calcium and some muscle twitching issues, or osteopenia, osteoporosis. Vitamin E tends to cause changes in blood clotting. They don't really see or feel that very much. They could have iron deficiency and anemia. They just might feel tired or pale or really short of breath. If the B vitamins get low, of course, they're going to be tired because those vitamins are used everywhere, but they might get sores in the mouth or a sore tongue, or the sores in the corner of the mouth, you know? Yeah. Those are really common. And then magnesium deficiency is super common. So restless legs, cramps, Charlie horses, twitching, constipation, high blood pressure, anxiety, all of those are signs of low magnesium.
That's really good to go over. Thank you. Mm-hmm. Talking about testing. So let's say our listener here is sitting there. Yeah, that's me. That's that sounds like everything that I'm experiencing, or I know someone that has that. Fortunately, all this is reversible, right? Like we can treat all this and improve it. What are the tests that you typically run to check this? You talked about food sensitivity being a blood test and looking for that IgG response. Describe what that test looks like on paper a bit, and then what are some other tests that can be used, if any, that, obviously there's a bunch that can test for a number of different things. What have you seen to be beneficial? Thankfully,
it's a simple blood test for the food sensitivities. If we're looking at children, we do a finger prick. So not an invasive, in the arm, what can be a stressful situation for young ones. So it can be just as simple as a finger prick. For adults, it's just a blood draw. You don't need to be fasting or do anything. But you do need to have the food. If you suspect you're sensitive to something, you need to have eaten it in the last 3 weeks for it to show up on the test. It's a blood test that checks for 96 different foods. So all the big ones you think about: dairy, corn, soy, wheat, but also fruits, vegetables, spices, oils, and yeast. So it can also tell me if there's a little bit of a yeast issue going on. We can check for food allergies as well by the blood test, which is also very helpful. And usually I'll decide if some symptoms are present that make me suspicious, I'll go ahead and add that in, or for some I may not. So we can decide to do that together or not. So that's definitely the way we handle the food sensitivity testing. We don't do skin prick testing or any, electrodes on the hands or anything like that. Those tests are very reliable. I've done 1 million of these for 11 years. And then we review that. Most importantly, you don't just take what comes on paper. You talk about it with your patient.
It's kind of nice to do,
Kind of advise that. Because what shows up may or may not be pertinent to what they're doing. So I review those results with the patient and go, how often are you having these foods? Because we're more prone to have food sensitivities if we have them 3 days a week or more. Right. And let's face it, we all have our routine, right? We have our shake in the morning. I've got my berries or my banana. We're in our routine. And so those things that we tend to repeat, we tend to have more reactions to. But sometimes we're like, why did coffee come up? I don't even drink coffee. Right. And it just might be a cross reaction. So it's really important. You don't just remove everything that comes up,
Yeah.
that's no fun for anyone.
Right.
My job is to figure out what do we think is really underlying the biggest picture here, the most cause of the inflammation, doing the most damage, that we remove, heal the gut, and then all these little things that are peppering in aren't really an issue. We should be able to have those in our diet a couple times a week without a problem.
Yeah.
When we're looking at like a leaky gut picture, definitely food sensitivity testing. We may also consider infection testing. So that could look like SIBO testing or stool tests. So sometimes that needs to be elucidated in a good history, whether I decide, what's more pertinent. And we'll talk about, I have the best stool test in the world. I get so excited about it. We'll talk about it. Also, I need to know kind of where their nutrient status is because there's so many symptoms that go on. So I'll likely be looking at a thyroid panel. I'll likely be checking their cortisol levels for adrenal health.
Yeah.
I'll do simple basic tests, nothing fancy, to look for their B12 and folate, their iron levels, their electrolyte levels. Are they getting enough protein in their diet? Is their liver okay? Glucose, like where are they in just basic terms? I can check B12 if they're having those symptoms, just some of the basic things that we talked about, the calcium, potassium, sodium, all that stuff will show up on basic blood work. We may check for the magnesium or I just could call it out usually when I see it and go ahead and treat that. So simple stuff, but those are usually what we're thinking of when we're looking at a leaky gut scenario.
Have you ever either experimented or looked into
the lactulose mannitol?
Yeah, there you go.
Yes. So that's what I teach traditionally. The gold standard is that gastros should be running in their office. They don't really do that anymore.
Yeah.
Mostly they're diagnosing people with IBS and telling them to just try a FODMAP or a GAPS diet or stop eating gluten or stop eating dairy. They kind of just jump to that step before they really assess what's going on. They might do a test for SIBO. Traditionally was a lactulose mannitol test, which is a drink. Lactulose is a sugar we cannot digest, and mannitol is a sugar we can easily digest. So when we drink it, we see how much of those ends up in the urine. We should expect to see mannitol in the urine, but not lactulose in a nice, healthy gut. And if we do see lactulose in the urine, it's because it's getting in through holes. It's getting into the bloodstream. That tells us that we have a leaky gut. The higher amounts of lactulose that are there, the higher amounts of leaky gut that there are. I can assess that by the food sensitivity test, but it's not just the number of foods that someone's reacting to, because when people fall into that 5 to 15 kind of foods they're reacting to, they may or may not have leaky gut. They may just have some food sensitivities. They also could have leaky gut. It's up to the practitioner and the patient to do a good history and figure out how serious and how long they think this is actually going to take to heal.
No, thank you for sharing that.
Mm-hmm.
When I have people that come into my office, one of the things that I like to do, if they have multiple symptoms, so the primary thing I treat is joint pain, right? And typically if I'm seeing someone, if I'm thinking food sensitivities with a patient, it's usually because they're in my office with pain in like both their knees, both their shoulders, different things like that. And I had one case in particular where the guy had pain in both knees, both shoulders, was also fatigued, had really bad sinus issues, had really bad like gas, bloating, bags under his eyes. I mean, it was like, it was so many symptoms. I mean, I think there was like 10 or 11 symptoms he was experiencing, but he was in my office for his knee pain because like one of his knees was bothering him more than the other. One of the things I like to do when I have someone that has that many things is I have a whiteboard in my office and I go and I write down every individual symptom that they have, kind of just analyze it really quick as they're telling me. And in his case, all but one of his symptoms, I was like, this looks like a food sensitivity. We did the blood test, found out that he had a huge sensitivity to dairy, removed dairy, and then within a month, like all his symptoms were pretty much gone, with the exception of the one. I can't remember what the one was, but pretty much everything else was gone. And, I think going in and making sure that we don't overlook something like this. Think of if he went, and I'm sure you've seen this in all the years you've practiced as well, where let's say I was an orthopedic doctor or something like that, I would have just treated his knee pain. The rest of it would have gone by the wayside. He would have gone to see an ENT for his nasal or for his sinus congestion, and gastro for his GI stuff. And really, like all those things would have been missed, like because they have the narrow lens, which is great sometimes. But in his particular case, it wouldn't have been. Can you kind of share some of the success stories you've had specializing in gut health, some of your favorite ones that had to do with food sensitivities?
Isn't it amazing, though? How,
it's cool.
Just one thing, right?
Yeah,
you cleared up everything.
Yeah,
Aren't we so grateful to be naturopaths, first of all? Isn't it nice that we just look at people holistically? Because this is what good medicine requires, right? You look at the whole, and when you put it all together, You have the best shot of helping. And then you got 11 out of 12 symptoms gone. And then you knew what the other one was that you really needed to focus on that had nothing else to do with that, right?
Absolutely.
Beautiful. Like beautiful. Oh my gosh. It just never gets old. So many, I mean, and you do this for so long, and I love what I do. And I think my patients know that. And I'm just a goober about naturopathic medicine. But like, I think particularly in children where they're so quick to want to remove the adenoids, to want to put tubes in their ears, to want to do things to little ones, because they're getting recurrent. So I had, 8-year-old boy with recurrent ear infections. He was sick every month for school, sinus infections, never felt well, extreme stomach aches, occasional rashes, beautiful family. I treat the whole family. So we ran the food sensitivity test, and it was dairy and wheat for him. His mom had significant dairy, egg, and wheat sensitivities. And so he already had a little bit of a genetic predisposition there just from mom. And so just cutting out, and children are so amazing in their ability to feel better and feel better so quickly. They're so vital, right?
Yeah,
when you
absolutely.
get the thing, boy, do they turn around so quick. And so it was amazing. I mean, he went a whole year without getting sick, no ear infections. They avoided getting tubes. He hadn't had any sinus infections. His mood was better. He was playing, socializing more. He lost weight because he was able to exercise more. And that's just, you catch it early. And then he would pass on his own. He said, I don't want cheese. I don't want that pizza. I'll take the other one because that doesn't make me feel well. They're so empowered. Adults, we rationalize everything. I'm like, well, okay, I'll just fart a lot tomorrow. It's fine.
Yeah.
They're like, no, I don't want to feel bad. That doesn't make me feel good. I'm not having it. And to see an empowered child is like, yes, because they're not going to be influenced, so to speak. They're going to stand up for their body. They know how they feel well. Oh my gosh, so many. Fascinating case, a gentleman who had severe spinal, cervical, neck stenosis, so narrowing and pressing on the nerves in his neck, and wicked heartburn. I mean, 10 out of 10 heartburn, and his neck pain was always worse when he ate. So there was a definite correlation, but he had severe structural issues, plates in his neck, definite pressure on the nerves, and bad pain. Worked on a train, did very physical work, and was gone for stints at a time. It was very hard to eat a proper diet when you're out in the middle of nowhere. You're just limited to what's around in small towns, which may or may not. There's a diner, and that's literally it. Like there's no Whole Foods. And so we did a food sensitivity test, and he did actually have leaky gut. He had a 3 out of 3 with the most severe reaction you can have to at least 20 foods on the page, different categories of foods. It was very severe. He had just wicked heartburn, but no ulcer, no H. pylori. He had a scope, and there was just redness. It didn't look that bad. But every time he ate, his neck pain was just so severe. So I started healing his gastritis and his, esophagitis while we were waiting for the test, and that helped. But while we started working on the big fundamental foods in the background, removing those factors, using things to heal the lining, helping him digest better, and then supporting his ability to protect himself from the heartburn, it made such a difference in his neck pain.
Yeah.
The structural issues hadn't changed at all. His physicality and his labor for working on a train hadn't changed at all. And he got 80% better in 2 months. Now, he had leaky gut, so we did treat him for 4 to 6 months. It took a little bit longer because he had so much more inflammation. It just takes time to rebuild that lining. Another, kind of like your patient, where it looks like a structural issue. He had seen so many neurologists, surgeons, orthopedic spine physicians, and came to me out of desperation, was like, I don't even know if you can help me or not, but they're not looking at me, and I need somebody to look at me in a different way. And to me, thank God we look at the whole person, right?
Yeah, for sure.
Because when you put it together, it was obvious. His neck pain and his heartburn were linked.
Yeah.
And when we could treat the whole thing, then his heartburn was gone. And he, now he lives in Flagstaff, and I don't even talk to him. I love the guy. And I'm like, get out of my life. Go live your life, enjoy your daughter, and be happy. That's the goal. We're not trying to keep him coming back. So that was a really interesting case.
That's awesome.
Yeah, very fascinating. I could talk for hours.
Oh,
but,
yeah, I know.
A lot of them look very typical, but those kind of abnormal cases definitely stand out.
Yeah, for sure. And that's why I asked. I mean, I've seen a number of food sensitivity cases at this point, and I don't even specialize in gut health. So the amount that you have is, like the amount that you've seen is, way more than mine.
And so it never gets old.
That's why, that's why I wanted you to share some of that.
Just to see people feel better.
No, that's perfect. I think we covered everything we needed to on food sensitivities. We went over testing. Again, the causes of food sensitivities are just having really poor gut motility, like antibiotics, number of different things that we talked about that can cause food sensitivities. as a whole, it is something that is treatable. So if there are symptoms and stuff that people are experiencing that maybe haven't found an answer to, this could definitely be something. One thing that you mentioned that I don't think I realized was how long it takes for leaky gut to actually get resolved, 4 to 6 months. I was thinking it was close to like 2 or 3 months. So that's
really important. I do try to be careful, to set expectations that it's not just remove this food and then have cheese every day in a month.
Yeah,
like that's not,
sure.
I mean, the body, it's a cry from the body to say, I'm tired of having the same thing all the time.
Yeah.
We're set up for variety, right? And so we listen to the body. I do want you to be able to have the foods you love, but not as much as you're having them now, probably. I'm very careful to explain my thought process and kind of whether I think this is a 2-month scenario or a 4 to 6 month scenario so that people know. And I explain the extent of the damage and what we're doing. Not that you're not going to feel way better within even a couple weeks, but that it might take just a little bit longer than the average bear because it's gone on so long. It is so intense.
For sure. And just like you said, I mean, when we're looking at treating this as, in individuals, whether it's mild all the way to the, leaky gut level, there's more to treating it than just removing the food itself. There's things that have to be either replenished, whether that's nutrients, gut bacteria, different things like that. In leaky gut, closing up those tight junctions so that we don't have those holes in the intestine anymore, quote unquote holes in the intestine. Yeah, so lots of things to consider for this. Dr. Retz, thank you so much for shedding some light on leaky gut and diving well into this topic. In our next episode, we're going to be discussing another special topic, which has to do with immunity. We're going to be talking about different infections that can happen in the gut, what good gut flora is, what that looks like, how that's beneficial, and then obviously everything that can go wrong with it. So, and then ways to test it, obviously. Dr. Retz, thank you so much for being on this episode.
My pleasure.
We'll catch you on the next one.
Do you know someone that is constantly busy and on the go? They probably wish that they can just hit a pause button for a brief moment to slow down their chaotic life. At Body Sense Massage by Ethos, we believe in nurturing and enhancing the greatest asset you have, you. Our therapists take time with each individual to understand their needs and provide a place to escape and recharge. Ask our team how you can schedule an appointment today so that you can tune out the world and tune into you.